Very good morning to all of you. I'm Dr. Meghana, Junior Resident, Regional Eye Hospital, Kurnool Medical College, Kurnool. And my topic is visual outcome in closed globe injuries. So ocular trauma is a leading preventable cause of monocular blindness and vision impairment in the world. The reported incidence of ocular trauma in India varies from 1 to 5%. Due to ocular trauma, 1.6 million people are blind worldwide and 2.3 million people have bilateral vision impairment. 19 million people suffer from unilateral vision loss. The severity of ocular injuries can range from minor non-life-threatening conditions like ecchymosis of the eyelid, corneal aberrations, subconjunctival hemorrhage, to extremely serious blinding conditions such as a ruptured globe, retinal detachment, traumatic optic neuropathy, intraocular hemorrhage, and orbital hemorrhage. Closed globe injuries are commonly encountered in pediatric age group, and the common causes of closed globe injuries include sports-related trauma, assault, and road traffic accidents. Occupational injuries are commonly seen in adults, and these injuries are associated with high-risk occupations such as agriculture, mining, plumbing, and manufacturing industry. So these are the few presentations we have seen at Regional Eye Hospital, Kurnool. In the eyelids, we have noticed periorbital edema and ecchymosis and traumatic ptosis. In the conjunctiva, we have seen cases of subconjunctival hemorrhage and conjunctival lacerations. In the cornea, we have seen epithelial defects. In the anterior chamber, we have seen cases of traumatic iridocyclitis and hyphema. In the pupil, traumatic mydriasis. Lens, we have seen subluxation of clear lens and a rosette cataract formation. Vitreous, we have seen cases of posterior vitreous detachment. In the retina, we have seen Berlin's edema and retinal detachment. Aims and objectives of my study: to study the clinical presentation of patients with closed globe injuries and to assess the final visual outcome of patients with closed globe injury following treatment. Inclusion criteria: all patients with closed globe injuries attending ophthalmology OPD and casualty of GGH have been included in the study. All patients with pre-existing ocular pathologies and open globe injuries have been excluded from the study. Material and methods: we have conducted a prospective study on 1 or 2 patients over a period of 12 months from September 2022 to August 2023 at Regional Eye Hospital, Kurnool. 1 or 2 patients of all age groups fulfilling the forementioned inclusion and exclusion criteria have been included in the study. All patients underwent a detailed protocol-based workup comprising of visual acuity testing, anterior segment evaluation with a pen torch and slit lamp examination, intraocular pressure measurement, posterior segment evaluation using direct and indirect ophthalmoscopy. Investigations such as B-scan ultrasonography, X-ray and CT orbits, MRI and OCT were done as per the indication. Results: in my study there were 76 male patients and 26 female patients in the study. The male to female ratio was found to be 3:1. So closed globe injuries were more common in the age group of 16 to 30 years of age, accounting to 36.2%. Males were more commonly affected when compared to females in my study. Majority of patients sustained injuries due to road traffic accidents, and it accounted to 46%. Pattern of injury distribution: subconjunctival hemorrhage accounted to 31.25%. The Snellen's best corrected visual acuity at the time of presentation was 6/60 or better in 83.4% of the eyes. At the end of 3 months, it was 96.5% of the eyes, and best corrected visual acuity 660 or better, while poor visual acuity of less than 660 or worse at 3 months follow-up was seen in 3.5% of the eyes. Discussion: the closed globe injuries were more common in the age group of 16 to 30 years and least common in patients aged more than 60 years. Males were more commonly affected when compared to females. Male preponderance is related to occupational exposure and driving under the influence of alcohol. Majority of patients are from rural areas with a limited access to emergency eye care facilities. Road traffic accidents have been found to be the most common cause, as they occurred as a result of rash driving under the influence of alcohol or driving without the use of protective measures. Anterior segment was most commonly involved in this study, and the presentation included subconjunctival hemorrhage, conjunctival lacerations, corneal aberrations, hyphema, iridocyclitis, traumatic mydriasis, traumatic cataract or dislocated lens. In our study, posterior segment injuries included retinal detachment, commotio retinae, and posterior vitreous detachment. The best corrected visual acuity at the time of presentation was 618 or better in 68.6% of the eyes, and less than 6/18 to 660 in 14.8% of the eyes, less than 660 to 360 in 7.4%, and 3/60 to no perception of light in 9.2% of the eyes. At 3 months follow-up, 2% of the patients were included in the blindness category due to traumatic optic neuropathy, commotio retinae, and retinal detachment. Ocular trauma is the major cause of ocular morbidity and mortality. Prevention is always better than cure. The impact of ocular trauma in terms of medical care, loss of productivity, and cost of rehabilitation services clearly highlight the importance of preventive strategies. Promoting safe riding practices and strict implementation of traffic rules is essential in preventing ocular trauma. Prompt transfer to a good eye care facility and timely intervention are important in preventing visual mortality. These are my references. Thank you.
Thank you, Dr. Meghana.